Thanks very much, Ruth. And I'm Shruti Narayan. I'm the medical director for SHOT, and I'm here to present on behalf of all our team members in the wider family of SHOT. And first and foremost, can I move the slides myself, or do I have to actually ask somebody to move? Okay, that's fine. And I would like to pause here and actually say a huge thank you to everybody in the healthcare community from all of us at SHOT, because I think it has been a difficult couple of years now, and everybody has come together with their selfless and hard work, and it seems to be relentless. It is actually still ongoing, but everybody, and what has come through is the compassion, collaboration, as well as coming together is actually what is actually taking us through these difficult times. I would also actually like to thank the organizers for shortlisting us, and we feel very honored and humbled as well to share this platform with so much of great work that is being done by everybody. And over the next few minutes, I would like to actually just provide an outline about the work that we do, about the impact on patient safety, and finish off with a few testimonials from our reporters, from our patient representatives, as well as from the transfusion experts. And to give an outline about what we do, safety is at the heart of everything that we actually do. Haemovigilance, or the surveillance mechanism that we have, drives improvement. So we collect the data. What are we doing with the data? What are the improvements that we are actually initiating to actually impact the transfusion safety? And now for any kind of a haemovigilance system to be actually successful, so if you go on to the next one, these are the key aspects. It is actually participation. So everybody should be participating. The data that we get should be reliable, should be accurate. And we also need to be actually distilling that intelligence from the information that we gather and make sure that the messages are actually there to recognize areas for improvement, to provide the recommendations. So it is actually a full circle and the feedback loops that need to be there. So it is not just about inputting the information, but it should be contributing to improvement. And that is what SHOT is all about. And if you can quickly go through this slide actually captures all the characteristics of how or what kind of a system SHOT is. We are independent, we are professionally led, but the couple of key things that I would like to highlight is reporting is confidential. And what drives is actually what can we do? How can we learn from our experience to drive patient safety? So therefore, we have 100% participation from across the UK. And it is professionally mandated. And what we really promote is it's a non-punitive. It is a just culture. It's a learning culture. We are reporting and sharing that reporting to actually make sure that we are sharing the lessons that are actually learned. And an important key aspect of the haemovigilance scheme is the near miss, because these are actually good catches. These are actually not near misses. These are near hits, because we are able to use these experiences where there has not been any patient harm and actually learn from them and make changes to the system. We've also introduced learning from excellence since the last couple of years. So we have actually now seen, the ACE, SHOT ACE category, which is actually then embedding the safety 1 and the safety 2. If you go on to the next one, as I said, we cover the whole of UK. And we collect the information on anything related to the transfusion, whether it is errors, whether there are any pathological reactions. Somebody has developed a fever, somebody has developed a chest discomfort or breathlessness. We collect those to actually see what can be done. Is there anything related to the component? Is there anything related to the process that we need to actually change to improve the safety? And everything related to the blood transfusion. So the blood components we would be collecting, but also there are, while there are errors related to anti-D immunoglobulin as well as prothrombin concentrate are collected by us. If there are any reactions, they need to be actually going via the yellow card scheme as well. And we are funded by the 4 UK blood services, and we are affiliated to the Royal College of Pathologists. Now, although we have a short core office team, what we really have is a wide family with our reporters, with patient representatives, and huge professional representatives as well. And the work, now the data that comes out and the recommendations, what do they tell us? They provide assurance about the blood transfusions in the UK. We realize that the blood transfusions are generally safe. So the big circle that is actually telling us, we have around 1.7 million components to 2.1. So if you take all the plasma components as well, 2.1 million components issued across in the UK. But the number of the major morbidity and the deaths are very small. So it is important to recognize that transfusions are generally safe. We've also shown that there has been a reduction in the transfusion never evens. Transfusion transmitted infections are also on a reducing trend. And what we are able to then identify is the errors. So it is mainly process-based safety that we need to actually focus on. better team working, better communication, better collaboration, and ensuring that we are working together as teams is the emerging theme that we see. If you go on to the next one. And also the other aspects from short data, what it has actually then impacted is it helps us make better transfusion decisions. It has also identified what are the patient groups that we need to focus, who are at risk. So the patients who are coming in and getting transfusions as day cases, are we giving the right post-transfusion advice? Are the vulnerable groups like pediatric as well as the older age group, patients with sickle and thalassemia, which are hemoglobin disorders, or transplant recipients. It also shines a light on all our blind spots and identifies improper practices and therefore identify key areas for improvement. Therefore, here we have where measuring and reporting is actually making an impact and allowing us to actually make those recommendations to make the changes in practice. If you go on to the next one. Now, more recently, since 2016, we've also been actually the trailblazers in introducing and incorporating human factors principles. You may all know this has actually come out in the National Patient Safety Syllabus as well. So now human factors is one of the core skills. And we have been actually collecting that for the last 6 years to actually highlight, where, we are investigating incidents. When we are learning from incidents, it is not just capturing. When you investigate, are you asking the right questions? Are you looking at the system factors, not just the individual factors? So we have actually then captured the human factor principles, bringing together the safety to learning from excellence as well, and trying to actually help. We have spoken about the nudge in a previous presentation. That's what we are trying to do. It is actually how do we help or work with the teams, work together with the people to inculcate the more safer behaviors. If you go on to the next couple of slides, I think if you can move. We have an app as well, and the important aspects for the success is actually about availability of the resources. It is, we have an app as well that can be downloaded on any smartphones, and we have accessibility to the transfusion experts as well as the haemovigilance experts. And we produce constantly, it is not just the reports that are actually coming out, it is the educational resources, both with videos and different short bites that can all be accessed on our website. And the link is actually provided in the chat box as well. Now, and ultimately, what we're trying to actually say is we are not sitting in an office and doing this. Haemovigilance is a collective team effort. Everybody has a responsibility, and we are working together with everyone to actually improve the patient safety in transfusions. And if you go on to the next one, we are just putting the patients at the center of everything that we do. What we are doing is improving the patient safety. We are also involving the patients, and we have those, we have patient representatives, as I said, they're involved in refining our messages, steering our activities as well. And there is open access. So our reports are all transparent. Our learning is also transparent. Anybody can be actually accessing, not just the healthcare professionals. If you go on to the next one. And this is, we have a few videos, so if you can play the video, please. This is Graham Donald, our patient representative on the short steering group.
Patient representative on the short steering group, which means that I have a say on the short report as it's being drafted. I aim to promote the interests of patients, the general public, and I hope surgeons or physicians who aren't transfusion specialists. SHOT's advice needs to be concise, clear, workable, and above all, easy to follow. I don't pretend to know the detailed clinical background to SHOT's recommendations, but I do need to understand the recommendations themselves. If I can understand them, then hospital staff should be able to understand them too, and to carry them out.
Thank you. If you move on to the next one as well. This is Charlotte Silver, who is a patient representative. So if you can play the video, please.
As someone with a chronic blood condition who receives regular blood transfusions, I'm delighted to be working with SHOT on the Continuing Excellence chapter. I feel privileged to be part of the team working to build a culture of safety and excellence.
Thank you. And if you move on to the next one, and the next one, please. You can quickly, pausing a few seconds, because these are a collection of our reporters. These are transfusion practitioners, laboratory experts who are actually there in different parts of the country. So as you can see, we have representation from England, Wales, Northern Ireland, Scotland, all of them actually then just saying about their involvement, how they have actually found the short reports as well as the short resources useful. And it's just highlighting that we are all in it together, working together to actually improve our services and improve the safety for our patients. And the important, I think we feel really privileged to be actually then working in SHOT to actually, what we are really doing is bringing everybody together, bringing the transfusion community together, the clinical and the laboratory staff, and all the other key stakeholders working together to actually to work towards the patient safety. And if you move on to the next couple of slides, we've also worked during the pandemic with the clinical trials. As you know, convalescent plasma was a new blood component that was issued, and it was tested as part of the two big trials, the DMAP-CAP and the recovery trials. And we were instrumental in gathering the safety data and working with the clinical trials unit. If you go on to the next one, we are also working with other key stakeholders like the National Blood Transfusion Committee, as well as the emergency planning. So this is in the words of Dr. Heidi Doughty, who is the clinical lead. And that is again highlighting the importance of collaboration. And if you go on to the next couple of them, we have a few more testimonials. This is Dr. Megan Rowley, who is with the Scottish National Blood Transfusion Service, and she's part of the wider SHOT family as a transfusion expert. And these are in her words, how important and how privileged we feel to be actually part of this haemovigilance activity. And if we go to the next one, this is a pediatric transfusion practitioner from Great Ormond Street. So if you can play the video, this is the last video here.
The SHOT data and the annual SHOT reports have been a critical factor in transfusion safety in the patients under the age of 18, particularly those under the age of 1 and neonates. The need for clinical and laboratory staff to be very familiar with paediatric transfusion, to understand the special transfusion requirements that many of these patients require, and to ensure the safe prescribing of the appropriate blood volumes for the weight of the child are these key safety messages that SHOT have very successfully delivered.
Thank you. And just the last couple I'll wrap up to actually then say, what we do is not in isolation. It is actually that collaboration. It is working together and coming together. And I think that is the biggest strength. It is in that collective thinking. And we not only work with the key stakeholders nationally, but also internationally, if you go on to the next one. So we work with the WHO as well. What we are trying to do is actually share our learning and help develop the haemovigilance systems in those nations where they are in different stages of the haemovigilance development. We're very happy to actually share our experiences in the journey, and this is what we have been actually working with the International Haemovigilance Network and the International Society of Blood Transfusion as well. And if you go on to the last one, as I say, although I'm standing here on behalf of the wider SHOT family, the SHOT team members. I have my team who have joined as well on this call, and it is just for the hard work that they put in, we are able to actually get this excellent work through. And we work collaboratively with all of these. It's difficult to go through everybody. I've listed everybody there, and thanks again for giving us this opportunity.